Hi, everybody. Lisa White here, IVF mentor and fertility coach with IVF Manifesting a Miracle. I'm here with our friend Dr. Greene today for a clinical conversation. This is a topic that a lot of people have sent in questions about, and I know you get this question a lot, Dr. Greene, and
every
frustration,
day.
all about unexplained infertility. So some people have sent in some just comments and questions, and I wanted to kind of start with just this is a very frustrating diagnosis for a lot of women to get. And, some women have been in this journey for years. Couples have been going through this for years, and they just want answers. Why is this happening? Like, will I get pregnant? They just want some answers. And is unexplained infertility kind of the best way to categorize this challenge? Or can you start us off with your reflection on this?
Yeah, what's important to understand is people don't realize that every time you see a healthcare provider, there's a diagnosis code that has to be put on your chart. Whether it's being submitted to insurance or not, there always is a numerical code. If it's an annual visit or a pap smear, whatever, there's always a diagnosis code.
Mm-hmm.
And that's where a lot of this comes from, is we have a need to code things. And so what ends up happening is, what a lot of people aren't aware of is the diagnosis of an infertility is a calendar-based diagnosis. By the time you reach somebody's office, you've tried for a certain number of months, depending on your age, and you've not conceived. So you have a diagnosis. Even before you meet with a healthcare provider, you have a diagnosis of infertility, because infertility is defined based on the number of months somebody's trying.
Okay.
And the reason that's an important thing to understand is people that are younger can try a little bit longer because they have more time on their side. So they revise the code. So it's, if somebody is not using contraception for 12 months without initiating a pregnancy, they have infertility, period. That's the diagnosis, okay?
Okay.
If somebody is over 35, it's recommended that you get evaluated if you've been trying for 6 months. And that's only because we know that fertility declines with age and you have less time to keep trying, okay? So the diagnosis is literally made before you made your appointment. But then we are required to be as specific as possible in the diagnoses that we code for. So once you reach somebody's office, there's certain tests that are done to try to, say, is this because of blocked tubes?
Are these
is
the
this because, is this
about,
because of absence of sperm? Is this because of something wrong with a woman's uterus? And the bottom line is you do a certain number of tests.
Right.
And then if you rule out blocked tubes, if you rule out absent sperm, if you rule out, some major uterine anomaly, then you basically still have infertility, but you don't know what it is. You know what it isn't, but you don't know what it is that's the cause,
Right.
And so they came up with a terrible term of unexplained infertility. And I've been in this 25 years. I've been battling that term the whole time because it drives patients crazy, because it sounds like we don't know what's going on.
Right.
And the reality is, it shows you the power of words, because what I've been proposing for 25 years now is that we don't call it unexplained, that we call it unspecified.
Unspecified.
And it's a simple verbal change, that instead of saying unexplained, it's unspecified. Unspecified means we know you have infertility and we don't know the exact cause. Whereas unexplained is heard by most people as we have no idea what's going on. And the reason that this is an important categorical change in my mind is because you could keep doing tests, but that's really a waste of time and a waste of money. Because if it's not going to change what treatment you recommend, then why do you really need more tests? In other words, more information is not going to say, oh, you're not infertile, because the calendar has already said you are. All it's going to say is that your infertility is caused by this. But the reality is, even if somebody has one specified cause, there's often 2 or 3 other contributing factors. And you can't put down necessarily 2 or 3 different things. And so, you get to a point where you take a practical approach and you say, do we really want to continue to chase why have you not gotten pregnant over the last year? Or do you want to be more forward thinking and say, what do we do to help you get pregnant over the next 3 to 6 months? It's a way of looking forward towards the future and resolving the problem instead of trying to look further into the past and try to explain what hasn't worked.
Thank you. Yeah, I know that's just a big frustration. And one of my friends said, and it's when they hear the reason they're not getting pregnant, it's unexplainable. It sends them the message that it puts them in just a darker, more helpless place.
Exactly. And that's why I think instead of feeling helpless, I don't know what's going on, you be more goal oriented and say, okay, we know that these variables affect your ability to achieve your goal. And based on that, there's 2 or 3 different options where you're controlling some variables or more variables or as many as science allows us to. And if an additional test isn't going to say, do this, don't worry about those 2 or skip those 2 and go right to that, then it's not a useful test. It's focusing on the past instead of focusing on the future.
Is there a point in your practice where you've done all the tests with some of your clients and there is still an unspecified reason why? I mean, do you always find a conclusion with your clients?
The most common reasons are things you can't test for. Like you can't test for egg quality. There's no test for that. There's no test for sperm quality. People think all the time, well, you're doing a semen analysis, you're just looking to see if there's sufficient sperm and if they're swimming and if they seem to be normal looking. But the real test of a sperm is, can it enter an egg and release the DNA in such a way that creates a fertile embryo? There's no test for that except putting a sperm into a healthy egg and seeing if a baby develops.
Is the quality factor, does that come in when you do the PGTA testing? Is that when you can see if the quality?
Yeah, because like for instance, there's some people that could produce 5 or 6 embryos and every single one is abnormal. With some of the testing methods that are part of the IVF process, when you find out an embryo is abnormal, you're actually able to trace that back to the egg or the sperm.
And that's based on certain tests through the genetic testing.
That's part of the IVF process, but you can't know that until you do IVF. Yeah. Now, another thing, for instance, is some people have problems related to implantation. Well, there's no way to test for that definitively ahead of time because you have to be sure that there's a healthy embryo in there to implant. So there's tests that we have that could suggest whether or not there might be an implantation problem, but to spend a lot of money, and we're talking about some tests that cost $1,000 or more and say, you might have an implantation problem. People say, I spent $1,000 for might. And they say, what do you mean by might? And the answer is, well, that month you definitely had an issue related to the lining. But we don't know what it's going to be like next month or the month after. So then you say, do you repeat that $1,000 test 2 or 3 months in a row? You're wasting time and wasting money.
Can you repeat that again with the receptivity test? Is that what you're talking about?
Yeah, well, there's a test. There's a couple of them, but the most common one is something called Receptiva.
Right, Receptiva.
Okay, and the Receptiva test is trying to predict whether there's an implantation problem in a natural cycle. Yeah. But the problem is every natural cycle is not necessarily identical.
Okay, so you're saying to do, I just want to clarify that.
No. My point is you could do this test, and then if it comes, back and it says it's normal, then does that mean it doesn't rule out that there's an implantation problem? It just says that on that month there wasn't one.
That month.
And so, you got to look at the risk versus the benefit and the cost. And in terms of the risk, there's no risk to the test. But the second question is, what's the benefit of that test? Well, there really isn't a great benefit because it's not going to change what you're going to recommend.
Mm,
and the cost is about $1,000. So if the benefit's not great and the cost is pretty substantial, then why
mhm.
do that test? Plus, it takes another month or
Yeah,
more
I know
to
that
do
delays
that. So
people.
it just delays treatment. So if you take more of a goal-oriented approach and say, here's a treatment option that incorporates, diagnosing and treating the implantation factor, and you could go to right to that if that's your concern, or you consider this treatment option that assumes there's not an implantation factor, and let people decide.
Yeah.
Because the reality is if you're moving towards a goal, that's more empowering than trying to answer a
Yeah,
question of why didn't things happen over the last 15 months.
I
And
know.
in most situations, you're not going to have one definitive answer. And what happens, we believe, in most situations is a lot of couples will fail one reason for 1 month, and maybe a different reason the next month, and
Oh,
maybe a different reason the month after that.
oh, it's so
And so you
frustrating.
can never be sure.
Oh my gosh, yeah. My friend, another one, we need explanations so we don't feel like we're being grouped together because no one wanted to explain it enough to us. You know, I don't know, just the unexplained infertility diagnosis. So it should be
Yeah,
unspecified.
it should be, in my opinion. Again, this is
Yeah.
the opinion of one, person with many years experience, but that's also gone through this. Is let's stop calling it unexplained and let's call it unspecified. It means, yes, there's a fertility problem. Here's your treatment options.
Hmm.
Here's your estimated chance without treatment. Let you decide,
Start a
because
new hashtag
in
with
other
that.
in other words, a different way of thinking about, going through with additional testing. Because I have patients that just have a need to know.
Right.
And I always say, I will order this test for you. But before we do, I want you to ask yourself, what am I going to do differently with this information? If the answer is, not, I'm not going to do anything different, then why spend the money? I'll give you another example.
Okay.
Okay. Um, Oftentimes we'll find that a guy has a mild male factor, or maybe even a moderate male factor, but he's still a candidate for IUI, okay, intrauterine insemination. A lot of guys say, can I take some vitamins and repeat the test in 2 months? Absolutely, if you want. But then they go, do you recommend that? No, I don't. Why not? And I tell them, I said, what are you going to do differently? They go, well, if it's better in 2 months, then I'll know the vitamins are working. I said, but if it's better and you're coming back to see me, you still haven't gotten pregnant. I said, and what if you come back and it's the same or worse? I still want you to take the vitamins.
Yeah.
So what are you going to do differently by waiting 2 months and repeating the test?
Interesting. Yeah.
You
You
know,
get
and the
people.
point is, it's not that you can't repeat the test, but
Mm,
it's just you got to think about what the cost is, the cost related to time and the cost related to money, because if you repeat the test and it's the same or slightly better, but you're still not pregnant, how useful was that?
yeah. I had a friend send
And
in
if
a.
someone says, I just want to know, then I say that's fine, but
Mhm.
but what I try to do, Lisa, is I try to be very forward thinking,
Mhm.
because what I want to always avoid is ordering one more test or repeating a test, and then I go over the results with someone. And they say, okay, what do you recommend now? And then I repeat and I recommend exactly what I recommended before the test, and then they're like, well, why do we do the test then? And then I say, exactly.
Gosh, I know every case is so unique, so different. Because I've had some people send in questions, how do I know when I'm ready to go to IVF? That's like a totally different talk, I'm sure. But
Yeah,
not everybody's a candidate for IUI. Like we were not. We were directed right to
yeah.
IVF. So like, I don't know. I think people see
And
their own.
that's why, in order to begin to answer that, I think the first thing people need to do is they need to stop looking back and start looking forward, you
Mhm.
know,
Great advice.
because, like, for instance, if you take this goal oriented approach, if someone wants to have 2 or 3 children, IVF is sometimes the best option, because if you could create embryos now and use one now, and have some in the freezer for later, that's a great option. Whereas if your goal is one pregnancy, sometimes leaning into the IUI or other things that are more low key are better. So again, it's taking a forward leaning approach to guide you in which option is best instead of a backwards leaning approach.
Yeah, thank you so much for explaining this hot topic of unexplained infertility. But
Unspecified.
I know we got to start the new hashtag unspecified, right? But no, it's a topic I see a lot out there. A lot of people struggle with this. They want answers, and
and and then I always tell people when they say that, I said, would you rather have answers or would you rather have a baby?
Yeah, exactly. Yeah, you're awesome. Thank you so much.
I mean, it's just a matter of helping people realize that, regardless of what the answer is, the problem is there. And the treatment options include both partners or the partner and a donor and a gestational carrier, whatever else. You know what I mean? So, you need enough information to adequately plan between treatment options or decide treatment versus no treatment. But a lot of times what you need to start with first is, what's my goal? I want to have one child. Or if someone's goal is, I just want to know if it's possible and I'll just keep trying naturally. Or does someone say, I really want to have 4 kids and I want my last child to be delivered before I turn 39. The more specific someone is, the more you start to be able to think they really need this option. And this couple might be satisfied with that option.
No, that's important for people to recognize, just to be clear on their own intention, what they envision as their ideal family, right?
Exactly. Goal oriented.
Perfect. Well, thank you. And people can find your blog at enhancingfertility.com, and you're at Conceptions, and I can be found at IVFmanifestingamiracle.com and offer personalized support on your fertility path. So yeah, reach out to us.
Stay happy and stay safe.
Stay well. Bye-bye. Thank you.